So I'm here to share my story with you of how I changed my life from burnt out, overweight, menopausal, depressed, primary care provider to the person standing in front of you now who owns a med spa, because that really wasn't my intention when I started on this journey. But this is the whole point of that, is when you put out there what it is you really want, you might get more than what you asked for. It might be better than what you envisioned. So be open to that. Be open to that. And along the way, I'm going to share some tips of how you can do that in your own life. And maybe I'll talk a little bit about beauty too. It depends. I don't know. Also, Sandra, tell me when to stop talking, because I'll probably just keep talking. Okay, so this all started around 2019. I was working at in geriatrics. I'm a geriatric specialist. For about 15 years, I was working at Yukon Health in their dementia diagnosis clinic. And I had an hour drive either way from home to that. But I love working with older people, loved it. So it was worth it. And during my drive, I listened to some motivational books. I listened to Eckhart Tolle's The Power of Now and Dr. Joe Dispenza's book, Becoming Supernatural. And I put into practice some of the things that I learned in my life, and it really transformed my life professionally and personally, and with my body and health. So I'm hoping I can share some things with you with this story. I am a nurse practitioner. I do have a doctorate of nursing practice. I attended Quinnipiac University here in Connecticut. I attended Johns Hopkins University for my nursing degree, and Smith College. I studied philosophy back when I was like 20. But it definitely informs some of the things I do today and what I think about in my practice. So I have started calling myself the Alchemista this year as a kind of a marketing thing, a fun thing, because I really do consider myself kind of a modern day alchemist. And alchemy is, an ancient practice of turning base metals into gold, right? So I want to help you turn your life into your most golden self, right? Like to radiate your glow and your beauty. We can make that happen with the pieces that we have and with the science that we know now. Like I was just talking with Kelly today. Kelly's one of the nurses who works at Milford Med Spa about menopause. Like menopause is my big thing right now at the spa. Besides beauty and Botox and filler and making you look your best with your skin, that starts from within really. You cannot radiate your most magical beauty when your hormones have left the building. So anyway, losing my train of thought. Why do we lose our hormones in our 40s and 50s as women? Because our ovaries stop working. Why does that even happen to us now? Well, really it's because of modern science, because of vaccines and antibiotics. So we are lucky that we're alive. I feel so grateful that I'm about to enter my 5th decade pretty soon. This is great, right? Isn't it? So, but in the meantime, I need to do something to make my life better, because I was feeling pretty shitty losing my hormones. And that's definitely part of what was going on. Okay, so anyway, back in 2019, right, I'm doing this 1-hour commute. I'm a primary care provider. Loving what I do, but I'm exhausted. My mom got sick. I had to become a caregiver. So I decided I need to leave that job and then find one closer to home. That's how I ended up working at a medical spa and becoming skilled in that, because I needed something easier than being a primary care provider. And so that allowed me to do that. But to take that big jump really was really scary. I had never not worked as a primary care provider. So these books that I had been listening to on my 2-hour commute every day really helped me develop a plan, and that's what I'm going to share with you. So when you are envisioning your new life, right, if you're feeling like you're stuck or you really need to have a change, this is what I did. I developed 2 lists. One of the lists was what I wanted my future to look like. What did I really want? What is it you really want? Not just, I don't want this stressed out job. What do you want? So what I came up with on my first list was I want more than enough time with my family, more than enough money, and to have work that is fulfilling and allows me to use my skills to help others. That's what I really wanted. So what I've learned from these books, though, is that it's not just knowing what you want. Of course, that's the first step. Then what do you do? This, I think, is the secret sauce. Make a second list of what your emotions will be, how you will feel when those things are true. So really envision what it will look like, but more what it'll feel like. What are the emotions? So my emotions on my second list, how I'll feel when these desires are reality, that I will feel fulfilled at work, I will feel love with my family, and I will feel freedom to spend time with my family and friends. So every day I looked at this list. I had it in a visible place and I thought about it every single day and felt it every single day. And I just trusted and let the universe show me the steps of what will happen, right? I did take an active part too in seeking and thinking about what I want to do, but more so than planning every little step of the way, I became open to what the universe was going to send to me. So this is not the first time I had done that, but it's also a piece of the secret sauce. Besides, number one, knowing what you want. Number two, feeling what it will feel like when you do it. Number three, left me. No. Number three is opening and listening. Keep your eyes open, your mind open for what opportunities will come your way. So whatever higher power it is that you believe in, whether you call that God, the universe, universal energy, whatever it is, science, whatever it is, be open to receiving what will come to you without being too restrictive of what that might be, because like I said before, it might be something you never imagined. And it might be better than what you imagined. But you know, I already said the things that I wanted were more than enough money, more than enough time. So I was open. So anyway, I left that job and started working on a med spa. And while I was doing that, taking care of my mom, I had I really cherished that year that I did that, and I'm really grateful I changed my life in that way. But while I was doing that, I also decided to start my own business. And also due to serendipity, I ended up taking care of primarily LGBTQ folks through a therapy practice that I had met with trying to find a therapist for my own child who is LGBTQ and not able to find an appropriate medication prescriber for that. So I was like, well, I've been prescribing psychiatric meds for like 15 years for older people. I'm going to transition my population to do that. So I did that too. I only did that one day a week, and I did med spa all the other days. But like the work was just so fulfilling, and I really did feel like I had accomplished a lot of those things that I had set out to do. I had such fulfillment in my work, not only with the psychiatric prescribing, but also with working at the medical spa. It sounds so superficial, right? Like it's just beauty, but just beauty. I mean, that's why I love this fest, this manifest beauty. Beauty is so important in our lives. And it's not just about the outer aesthetic. It's about what you feel inside, making your life beautiful. But anyway, what I really enjoyed working at the medical spa back then, I did laser hair removal, and I had a lot of transgender folks coming in and having hair removed prior to like feminization surgery and stuff. And like, I also would have women come in, cisgender women come in for also gender affirming laser hair removal therapy for their face. Like women who have PCOS get a lot of hair on their face, right? So just the simple act of removing hair would, you could see their whole persona transform, their whole life transform from something like that, making the outer reflect what was on the inside. It was just beautiful. So anyway, I really enjoyed taking care of that patient population. And the whole point of this is that, you know, I use those techniques. Make your list, feel it, and then remain open to what comes before you, because I had no idea that I would be starting my own business when I left that job. I mean, that's probably the last thing I would want to do, is to take on another responsibility, because I took on caregiving. But it ended up being really fulfilling, and it came to me through something negative, really. My own child was depressed, and I had to find a therapist and stuff, but I enjoyed doing that so much. And then when COVID happened, we all remember COVID, I left the medical spa because I didn't want to be exposed to that, and I transitioned my entire medical practice to online telehealth. So I help people with mental health full-time throughout COVID. I really found that fulfilling as well, but I didn't want to lose my skills as an injector. So I opened up my own account with Botox and did stuff for my friends and family out of my house. And then a stranger came to my house, and I was like, no, this does not feel right. I rented a little room on 31 Cherry Street over here in one of these little old houses, and my business just took off that year. So this is what I mean, like back when I made that list, I did not think that I would own a business, number one. Number two, own a med spa, no. But after a year there, it was so successful. My lease was up, and I was like, all right, am I gonna keep doing this? Like, this is great, or do I wanna take a jump and do something bigger? So I did that. I took a jump and did something bigger, and this is, we completed 3 years now where I am, and I now have a staff of about 12 or 13 amazing women. We are a woman-run business. Yep, nurses, esthetician, my amazing marketing staff, Allison. And my daughter works for me too. So anyway, we are over there, you know, bringing beauty into people's lives through our medical spa, and something that we have really developed over the past year, maybe, or a little more. I've been doing it longer, but over the past year, we really focused a lot on hormones, because hormone care is also something that transformed my life. Because I did mention I was menopausal, right? A lot of people, they look at me and they're like, no, you're not. I'm like, no, yeah, I am. This happens from working out, medication, hormone replacement, medical grade skincare, and biostimulating treatments, so science. So when I say I'm the Alchemista, that's because I use science to transform my body from the inside out. And then that, you know, that radiates, and I love doing that for all of our clients. Thanks. I'm trying to see if there's anything else I wanted to share with you. Oh, so I wanted to ask you some questions about hormones, because I get to speak, and I can't have this microphone without teaching you something. Okay, I want to see a raise of hands. If you believe that women's bodies make testosterone, do women's bodies make testosterone? Yes, raise your hand. Okay, all right, love that. All right, most of you do believe that, and it's true. We make testosterone. When our ovaries are aging, 3 hormones go down. First is progesterone, second is testosterone, third is estrogen. So that's like the last one to go. Okay, here's another. Do you know which of those hormones, testosterone, estrogen, progesterone, protects women from breast cancer? Does anybody know that one besides someone who works for me? Which hormone prevents breast cancer in women? In studies, they found the higher this level was naturally in women's bodies, the lower the likelihood they would get breast cancer. I'm hearing estrogen, I'm hearing testosterone, and the winner is progesterone. Yeah, most people don't know that, and we all need to know that. I am on a mission this year to make sure that everyone knows progesterone prevents your risk of breast cancer, big time. So in addition to the women having higher levels of progesterone in their body, had lower risk of cancer. Additionally, if you took bioidentical progesterone, it also lowered your risk of breast cancer. I just want to clarify that does not include synthetic progesterones, which are in oral contraceptives. So you might see things called progestin or norethindrone. Those are synthetic. They do not protect you from breast cancer. Yes, boo to those. They're good for preventing pregnancy. But like when you're in perimenopause, when you're like 35, 40 or whatever, you should really think about switching or doing something different. Because the synthetic estrogens and progesterones are really not good for you. They raise your risk for cancer. Whereas the bioidentical ones, which means they're the same exact ones your body makes, protect you from breast cancer. All right, I could keep talking, so just give me the sign, Sandra. So, does anyone know the #1 killer for women? The #1 cause of death? Did I hear heart disease? Yes, heart disease. Okay, so that's right. Which of those hormones, do you know which of those hormones protect you the most from heart disease? I love that. It's not progesterone this time. It's estrogen. Yeah, estrogen. Yep. So estrogen got a bad rap back in like 2002 when I graduated from nurse practitioner school. So, you know, people who are in the height of their career right now, like me, learned that it was bad. The estrogen was bad. And a lot of women got taken off of their estrogen because of that, and unfortunately have suffered osteoporosis, heart disease. What else? Brain fog, hot flashes, just dry vaginas. Yeah, and estrogen also prevents dementia. Testosterone prevents osteoporosis. So, like, I just encourage you. I'm so grateful for you all listening to me too, but it's just so important. Any woman in your life, if you're not a woman, just share the news about this stuff. You can prevent a lot of illness. Like, I saw so much chronic disease and illness in my career as a geriatric provider. I don't want that for me, so I am on estrogen, not estrogen, sorry, I don't need that yet. I'm on testosterone and progesterone, and it really was life-changing for my body and for my relationships too. Testosterone is a libido booster, it's a good thing. But anyway, know your hormones, know your options. There's a book I recommend to everyone, it's called The New Menopause. There's a new one coming out called The New Perimenopause. If you read those, you will be an informed decision maker. Educate the women in your life, because you might prolong their functionality and happiness in life. Like, we live now into our 80s, 70s, 80s, but the functional decline that I saw happen in women exceeds what I saw in men. And like, we can stop that. We can make it better for women's lives. All right, I'm gonna stop talking, but thank you so much, everybody.
Look at that, I just learned some new things too, see? It's good to have smart people up here talking, right? Thank you very, very much, Courtney. That's Milford Med Spa, 99 Cherry Street. So if you are looking to get some things done, oh wait, okay, I'm gonna turn down the gain in 2 seconds.